It's called Special Services at Home, and about 30,000 families of children with disabilities depend on this funding to provide specialized care for their children, day camps or nursing, things to improve their quality of life and really to give them a childhood. It's only a few $1,000s a year, but it's what the Taylor family uses to provide their 8-year-old son with specialized care. And now CityNews has learned that those payments are in limbo.
It's unfortunate to hear that now the funds have, we've been told paused, we've been told frozen, we've been told held. With not knowing, it's kind of hard to really judge what we're going to do this coming year.
The Taylor family typically receives about $1,700 a year through the Special Services at Home program to help them care for their 8-year-old son, Paul Jr.
He's on the autism spectrum. He also has type 1 diabetes. He needs somebody who's going to be well-versed with diabetes and understand that he won't be able to understand the lows and the highs that he's having.
Oh. The Taylors used the funds for respite care while they were running errands or working. Paul Jr. had somebody at his side who knew how to properly supervise him and helped him engage with people outside of his home socially. The Taylors even got an email earlier this month which read, "Your contract for 2019-2020 was automatically renewed for the same amount." But then just days later, they got a follow-up email. The ministry will communicate updates regarding Special Services at Home and enhanced respite renewals for 2019-2020 fiscal year after April 11th, 2019.
When you start holding back money from the most vulnerable children in this province and families, it is a huge problem for them. We're talking about a few $1,000s that actually allow children with complex special needs to get the services that they need to live better lives, and it's a shame.
Play with the dog.
It's created a whole new level of uncertainty for a family that's already been hard hit by changes to the Ontario Autism Program. Paul Jr. used to receive 20 hours of therapy a week. That changed last summer.
Paul has been reduced to 4 hours. So this, too, has been a big slap in the face. Our son just started speaking and communicating through PECs. At 8 years old, he's still having to wear diapers. And that's an embarrassment for him, you can tell.
And while he's made significant progress, Nicole fears the changes to the autism program could threaten that.
Right now, we've been told that he could actually receive 1 hour a week going forward, so that'll be another cut again.
We've been seeking answers since Friday, and we tried to speak with the minister responsible, that's Lisa MacLeod, but she refused to speak with media today. Instead, we got a statement from her spokesperson, which reads, "We have not sought a reduction in funding for the Special Services at Home program. We will continue to support all families of children living with developmental and or physical disabilities across the province. But the uncertainty that this has created for the Taylors and tens of thousands of other families have pushed them to the edge."
It's sad. It's just so sad.
Now, the date that the Taylors and several other families have been told a decision will be made on their funding is the same date that the provincial budget will be delivered, and that's April 11th.